All right, welcome everybody. Welcome back the people who came to who are here for the Friday Huddle just a little bit ago, and for the new people, welcome. Thank you so much for being here. Just as a reintroduction for the new people, my name is Jana Bitton. I'm with the Oregon Center for Nursing, and I am really pleased to be able to introduce Dr. Rick Allgeyer, who is our research director. We are, for those of you who are not familiar with the Oregon Center for Nursing, and I recognize lots of your names and I think you are, but for those of you who are not familiar with the Oregon Center for Nursing, we are the state's nursing workforce center. We are a nonprofit organization that looks at data related to the nursing workforce to try to get the information needed to make informed policy decisions for legislators, policymakers, educators, employers, nurses, all the way across the board. If you've never been to an extended cut of the Friday Huddle, this really is just going to be a short 30-minute presentation to let you know kind of what are the data sources that we have here in the state of Oregon, and how does that compare to the National Sample Survey of Registered Nurses that was put out by HRSA that just was released last month. So for that, I'm going to turn it over to Rick. We're going to have a chance for some questions at the end if you want to ask some questions, but you're also welcome to go down into the chat and you can put any questions in the chat as well, and we can address those as Rick, do you want to go as we go along? You want to address
Yeah, let's
questions?
do that because I'm afraid that if I get too far into, because we're going to be moving across different topics pretty quickly,
Yeah,
and I don't want to miss questions.
that sounds good. So if you have any questions, you can put it up in the chat. And we'll also have some time at the end. So with that, Rick, I'm going to turn it over to you.
Cool. Thanks, Jana. Hi, everybody. Welcome this morning. I'm glad y'all came. My name, as Jana said, my name's Rick Allgeyer. I'm the research director here at OCN. And today we're going to talk about some data sources. So I'm going to talk about a couple different things. The first thing I'm going to talk about is how you choose what data set. There are lots of different data sets that are available to folks, and they all do kind of different things. Some data sets are better for different questions than others. We're going to talk about that a little bit. We're going to talk about where you get those data, and we're going to talk a little bit about the pros and cons of using each data set. We're going to really focus on the national surveys, which is the NSSRN is one of them. We're going to focus on that one because that's a new one. We're also going to talk about data that we can get from the state. That's a combination of data from the state board and OHA's workforce survey. We're going to talk a little bit about those too. And then we're also going to do a demo on the NSSRN because there's some things that are a little counterintuitive with it that you kind of have to be aware of when you're pulling data from that. So let's get started. Why is this not working? There we go. So the first question you always ask is, and this is something that I know I badger Jan about this all the time. When she asked me for a data set or a data request, it's like, okay, what are you trying to answer? What question do you have? Everything when you're doing research, as you probably got beat into your head when you were in school learning about research method, the first thing you have to do is define the question. You cannot proceed without defining your question. So when you're looking at data sets and deciding which one to use, you really have to focus on the question. There are some questions that and oftentimes the question itself will direct you. So for instance, if you want to know how many nurses are employed in the state of Oregon, you would go to the employment department because they have the employment data. If you want to know how many nurses are licensed in Oregon, you wouldn't go to the employment department because they don't know. You will go to OSBN data. So that kind of, I mean, I know that's a very simplistic example, but most of the time you can boil it down to something pretty simplistic. And again, every data set has pros and cons, benefits and limitations. It's important to understand what the data set can tell you. It's as important to also know what the data set cannot tell you. So we're going to look at the principal data sources that we look at. And we're going to talk about the first two. The last two we're not going to talk about too much, but I'm going to mention them here. The first one is National Comprehensive Sample Surveys. The NSSRN is one of them. This is done by HRSA. The other big one is done by NCSBN. It's done every 2 years. The biggest issue with NCSBN data is most of the stuff you get from that is a report. You can go through some gyrations with NCSBN to download the data, but it generally is not accessible to the population at large. You have to ask for it, and you have to go through some jump through some hoops to get the data. But the NSSRN data, it's a government entity, it's open, right? Anybody can get those data. There's a lot of support, technical support for the NSSRN. The Health Workforce Technical Assistance Counselor Committee out of New York, and we'll put that in the chat towards the end. Has a lot of webinars and such on how to use the NSSRN. The other one is state licensing boards and associated workforce surveys. These data are also, since they're government, they're pretty open, and you can download those or request those data, and they will give them to you. Those answer much different questions in the sample surveys. The last one is the employment data. Employment data is basically talking about how much, talks about wages and employment strategy and the number of nurses that are employed. Its biggest limitation is it does not give you any information about the practice setting that the nurses is employed at. It also does not talk about their role. Also, it misses a lot of nurses, like nurse educators and public health nurses are not included in the registered nurse line because they're counted in other places. So you have to really understand where nurses get counted out of the different categories. And the last one that I'm just going to briefly mention is local, regional, and professional association surveys. We look at this stuff all the time. We refer to it as the gray literature because it's usually not peer reviewed. It's put out by organizations. Some of those data are really of high quality. Some of them are not. So when you take a look at these kinds of data sources, please read the method section to make sure that you're not getting some kind of weird bias. You want to look for things that are random selected samples or those kinds of things. If it's, anybody can if it's a web-based survey that they're just inviting anybody to fill out, those typically have some issues that you just need to be aware of. But anyway, we're going to talk about the National Sample Survey of Registered Nurses. I'm just going to be referring to it as a sample survey because NSSRN and the National Sample Survey of Registered Nurses is just too time consuming to talk about that much. So I'm going to be short and just call it the sample survey. So the sample survey is conducted by the Census Bureau. It's on behalf of HRSA. The Census Bureau does a lot of stuff. Most of the surveying that is done by the federal government is actually conducted by the Census Bureau. They're really good at surveying and stuff. The other one is the NCSBN National Workforce Survey. The last one was done last year. It is published in the Journal of Nursing Regulation. That is NCSBN's journal. So these are readily accessible data sets. NCSBN is, NSSRN is what I'm really focused on. It really is geared towards looking at characteristics of the nursing workforce. It is not intended to provide census numbers. And we'll get into that in just a second. Why not? The best reason I like to use the NSSRN is because it allows me reasonably quickly to look at comparisons across states. So I can look to see what we're doing versus what Washington's doing, or what we're doing versus what Texas is doing, in terms of characteristics of the workforce, education, practice settings, those kinds of things. They are as it says in the title, the NSSRN is based on a sample of nurses that are invited to participate from each state and territory of the United States. So they draw a random sample from each state. Their base data for registered nurses actually comes from NCSBN. For NPs, it comes from the American Association of Nurse Practitioners down in Austin. So they're building up a sample from those things, and they send those things out to all the nurses, and then they rely on the nurses responding to those things. There are inherent biases in these sample surveys because Not everybody fills it out. And so there's a bias on who, it's called non-response bias. And it's who's completing the survey versus who's not completing the survey. And is there a systematic reason why people do or do not do it? That can really influence the results of the survey. Because it's based on a sample and they have to extrapolate back up to get state level numbers, they may not provide an accurate state level view or political subdivision census of who's licensed, even though they try to estimate that, but it is an estimate. And so sometimes they can get it wrong. There also may be errors limited to one or more variables of the data set. For instance, in the 2018 NSSRN, HRSA made a weighting error, and it is undercounting Hispanic nurses in the country by a lot. It's a significant find. Because the 2022 data are still out there and researchers haven't dug through it to the degree that they've dug through the 2018 data, we don't know the limitations of the 2022 data yet. We're just looking at it. Well, actually, that's not 100% true because we do know that there's one error in the NSSRN, and we'll talk about that in a little bit. One of the good things about the NSSRN is the data sets are static and refreshed every few years. The static means is if I run an analysis today versus next month, the data sets are going to be the same. So I'm going to be making apples to apples comparisons based on my analysis. The NSSRN is starting to be I think they're going to be refreshing this every 4 years. Is that right, Jana? In the past, they have not been quite so regular in their updating of these data. For instance, the 2018 data, the NSSRN that happened before that was actually done last in 2008. So there was a 10-year gap between that. And that's one of the reasons that NCSBN jumped in. Man, there's so many acronyms. And I'm the acronym king. So, it's still throwing me a little bit. But anyway, that's one of the reasons NCSBN jumped in to do their sample survey every 2 years, is because HRSA just wasn't doing it that often. So here's what we're going to talk about with the NSSRN. It was fielded between December 15th, 2022 and April 13th, 2023. About 120,000 nurses with active licenses that were on December 31st, 2021 were invited to participate. For a little over 49,000 nurses completed the survey. So keep that kind of in mind when you're looking at these data, that it's really that this whole survey is based on 49,000 responses. That is a big number, but when you're trying to divvy it out by 50 states, it gets a little funky. So actually what we're going to do now is we're going to go into, I'm going to see if I can shift my screen and share another bit of data. We're actually going to look at the NSSRN a little bit. And there it is. All right. Can everybody see this? All right. So this is what the NSSRN, on the PowerPoint slide that we will send out, there was the link to these data. So this is the dashboard. This is what most people use. You can definitely download the data, but you'll download the whole thing. And actually using the NSSRN as a sole source for Oregon, I would not recommend doing that for a couple of reasons. One is we're a pretty small state, population wise. And so it's based on a sample of Oregon nurses, and it's going to be a small sample. It'll probably be less than 1,000, maybe 1,000, maybe 2,000 people at max. Are going to be used to estimate these things. So if you're really looking for things like that, which we'll talk a few minutes. So there's a couple things to be aware of when you're looking at the NSSRN. There are lots of different things you can look at. This is actually, I'm looking at the 2022 data. You can look at the 2018 data. There it goes. Oh, please do me. Yeah, you'll be doing a lot of this. It's not the speediest. Okay.
And I just put the link in the chat in case
Yeah.
you have passed in case
Yeah.
You're able to pull it up where you are. If you want to take a look at it on your own computer, there's a link in the
Yeah.
chat for that too.
Okay, there we go back. Okay, so the 2018 data, I am going to go back to 2022. Just know that there are 2 years available on this thing. There we go. Oh, that was pretty quick. Okay, a couple different things to really take a look at is one, when you look at the region, it's default all United States, but you can go into any state or territory. And so I'm going to go to our home state of Oregon, and it updated pretty quickly. Okay, it tells us there's 61,000 licensed nurses. That's not exactly right, but it's pretty darn close. It's pretty darn close. The problem is I just made an error. And by looking at my selection screens, you won't notice that error. So when you look at license type, you have to pick RNs, not APRNs, because technically an APRN is an RN. They have an RN license. And the NSSRN does not distinguish them. You have to specifically pick RNs only. And when you do that, it drops down to 58,000 nurses, which again isn't exactly right, but based on the time frame, it's close. And it gives you some general information about it. You can also look at licensed and employed or licensed, whichever you want to do. Usually when we look at data, we look at employment numbers because we're really interested to see um, who's actually working in the state of Oregon in nursing. So I'm just going to continue to look at licensed, but you have to make sure that you pick the license type appropriately and take a look at it. Otherwise, if you just pick the RN only, you are actually grabbing all of the APRNs as well. Okay. So that's the first thing you do. The other nice thing about this is it does allow you to compare things. Um, and so, unfortunately, what I was hoping for was that you could actually look at across state comparisons. This only allows you to compare 2018 to 2022 data. But again, I can pick Oregon. And so you can see a lot of things from 2018 to 2022 in terms of our average license and those kinds of things. Um, it's mainly employment comparisons, work environment comparisons. I'm gonna pick on work environment comparisons just so you can see. It's got some job satisfaction stuff because they asked that in the survey. These are reasonably new questions in 2018, those kinds of things. Um, the other thing I want to look at is education and licensing, just because that's kind of where we go a lot. Um, there we go. Okay. And then also, again, I'm going to look at, since I want to look at RNs, not APRNs, I need to go down and pick that. So this is right here. It'll tell you what you're looking at, what year you are, just so to make sure that you're on the 2018, 2022 data. And we typically look at highest degree, not initial degree. And so here is some information on how many RNs, not APRNs, but RNs have bachelor's degrees, um, had the ADN or an LPN to RN degree, a master's degree, doctorate degree. This little chart actually gives you some interesting information about the difference between your initial degree, the degree you had when you were licensed versus your highest degree. So you can see how many people move from an ADN into a bachelor's degree and those kinds of things. So it gives you a lot of information that's really quick to access. The characteristics we take a look at to make sure that they compare percent wise or close to what we're seeing in Oregon. And generally, they do a pretty good job of giving you proportions of who has an ADN, who has a BSN, who works in a hospital. All those kind of variables are usually pretty good. The problem we run into is with our census numbers. And I'm going to illustrate that right now by looking at NPs only. And I'm going to look at demographics because that'll tell you. Okay, so here's where we ran into one of our issues. So I picked Oregon, I picked NPs only, and I'm looking at 2022, and it says we have 2,500 licensed NPs. That is so wrong. In reality, we have close to 7,000 NPs. At this time, I don't know exactly where where the issue is. Generally, what ends up happening is when they do these data, they're aggregating and everything back up to the national level, and then they're appropriating things out to the state. So it's called a top-down model. So they do all the projections and all the estimates at the national level, and then they trickle them down to the states. And somehow they got it. This is totally incorrect. In reality, step away for just a sec. We have 6,699 NPs, and we're estimating 5,200 of them are actually practicing in Oregon. When I look,
Rick, can you tell them really quickly why we are seeing higher numbers compared to what they're saying? What
well, we
data
don't know
source? What
we
data
don't,
source are we looking at?
well, okay. So we're looking at the licensing data from OSBN, and it is also timestamped. I'm going to talk about it more in a second. But what I also want to look at is when I look at the number of licensed and employed NPs, it drops down to 1892, which is, again, about a quarter of what we were actually expecting. So if you want to grab census data, do not use the NSSRN. If you're interested in characteristics, how many are educated this way or whatever, age categories, race, ethnicity, where they work, gender, this is all fine. If you're looking for a census, I wouldn't use these data because they have issues. We haven't worked out what's going on with the NPs yet. The base data for this comes from the American Association of Nurse Practitioners, and those data are proprietary. I have not seen the actual ways that they have them broken out. That's a little bit, it's kind of one of those black box magic things. I just don't know. It's knowable. I just don't know it yet. Most people, these data are still pretty new, and researchers are definitely taking a look at it. And then we'll figure it out at some point. We'll figure it out. So I'm going to go back to the PowerPoint so we can, let's see, there we go. There we go. Okay. Okay. So we just talked about the NSSRN. The other thing I'm going to talk about is licensing board. I know we have about 7 minutes, so I'm going to go through this pretty quickly. Licensing board maintains records of every person who has a license in the state. It's associated with the workforce survey. Any nurse knows that when they've renewed their license, after they pay their fee, they get shipped off to another site to fill out a fairly lengthy workforce survey. This is where we get our data. It's completed at licensing renewal, which can be problematic. The advantages are they provide an accurate census of all the nurses, and they an accurate assessment of the characteristics of the nursing workforce, statewide and in political subdivisions. You can also get data from OSBN's website. It is live, so it's updated constantly. So if you want to know how many nurses are licensed in Oregon right now, go to them. The data that we get from OHA, the health authority, is static. So once they draw a data extract, that's what you're getting, and we're working with the 2022 data set. Data from the workforce is static, but it is updated regularly with a known timeline, which is really important because you know that in 2 years you're going to get a new data set. There are some limitations. Because the workforce survey is only completed upon renewal, we know very, very little about nurses that are newly licensed, like in the past 2 years. We know basically the year they were licensed, and we know the license type they have, and we know their date of birth. And that's about all we know from this OHA data. So we are looking at data that isn't fully complete. It's got about a 2-year lag to it. These data also don't tell us, even though they ask a lot of questions in the survey about employment status, where they work and stuff, that's possibly changed. It reflects a snapshot and may not reflect current situations. But in reality, for most purposes, the OHA data really is the data set that we use a lot. It's not quite as easy to use as the NSSRN. So if you're just looking to see how many nurses have a bachelor's degree or an associate's degree or whatever, those kinds of issues where you're just looking at the nature of the characteristics of the workforce, NSSRN is a pretty good data set. But if you really want a census number, call us and we'll give it to you. So thank you so much. That's all I had. Are there any questions?
Yeah, thanks, Rick. And while you are forming your questions or thinking about that, just so you know, in the chat, I have been putting links to all of the data sources that Rick was talking about while he was talking about them. So that's where you'll find OHA's Healthcare Workforce Reporting Program, their survey, the OSBN reports that are updated they're in real time, so you can kind of see what that looks like. And the NSSRN dashboard, the NCSBN National Nursing Workforce Survey, and also the Healthcare Workforce Technical Assistance Center. So all of those links are in the chat. Anybody have any questions?
Mm-hmm. The question on data on nurse educators and nurses working in academia, that can be found in the OHA data. We know based on their employment, we look at two different things basically. We look at practice setting, which is hospital, nursing education, whatever. And then we look at a job title. So they will talk about being a nurse associate, a nurse educator associate, and a nurse educator. So we can get all of, we get all that stuff out of the OHA data.
Yeah, great. Andy Davis from OHA is here, and he
Mm-hmm.
is the lead of the OHA Healthcare Workforce Reporting Program. And he put in the chat, I'll just say from the OHA perspective, we'd be happy to work on surveying new licensees to get that data too. So that
Yeah,
might be
Andy,
something
we'd
that we
love to
can
have
look
it
at in
too.
the future.
Yeah, we'd love to have that as well. But right now, since it's based on renewal, we do have a little bit of lag in the data.
Yeah. Joy put in the chat, this is eye-opening. Only 11% of our nursing workforce in Oregon has an MSN, and that's a group that's eligible for nurse faculty positions. We need to focus on growing this number if we want to work on future nursing shortages. Yes, we do. That is, I think that there's been, there are many discussions about the number of master's degree and advanced degree
Mm-hmm.
programs that we have in our state. That would be part of that. Rick, did you have
Yep.
anything on that one?
No, that's and one of the other things is there's also a limited number of programs in the
Right.
state
Yes.
that do master's degrees, but there are also a lot of online opportunities.
Correct.
But yes, that's a workforce that we need to grow in order to get. But in reality, based on our numbers, there's about 4,000 RNs who have a master's degree, which is it's not as many as we want, but it's a fair number
It's
of people.
a big chunk if we're looking at nurse faculty
Yeah, because we got
opportunities to see if any of those would either want to or be inclined or be open to training to be nurse faculty.
yeah. So it is a little daunting to kind of remember, but again, just to reiterate, everything's based on the question you're trying to answer. So if you're looking at employment department probably is an appropriate place to start. You have to understand some coding and stuff. If you have questions, give us a holler. We can definitely help you out with that. It took me a little bit of time to understand how we do it here, and how we count things and how things are organized. But the OHA data set is the one I typically use. I often will go to NSSRN if I'm trying to compare something with what do an interstate comparison of how Oregon does something versus Washington, California, or something like that. Thanks, Jen. I was about to do that, but I cannot multitask very well this morning.
That's perfectly okay. All right, we are at time. Thank you everybody for coming. We put Rick's information in the chat. If you would like to reach out to him with any specific questions or want to get a little bit more information on this, for those of you who are part of the reporting, we'll add this to the comments. in the description. So you might be able to, so you will be able to get his email address. If you have any questions at all, please do not
Right.
hesitate to reach out to us when it
Right.
comes to this data. Go ahead, Rick.
Are we going to send out the, can we send out the PowerPoint slide deck too?
Yes, we can send out the
Okay,
PowerPoint.
and then my contact information is there. There's also a link to the NSSRN data.
Perfect.
So
All right. And with
thank you all
that,
very much. I really
thank you.
appreciate